Now let me introduce Dr. Halil Ozcan, medical doctor, and actually it's a neuropsychologist from the Ataturk University Medical Faculty, Department of Psychiatry and Neuromodulation from Turkey. Dr. Halil, please start. He's going to talk about his experience by using the Photino brain laser therapy devices, some psychiatric steps.
Yes, thank you very much. Let me try. I'm trying to share my presentation. I think it's okay now.
Yeah, it's okay.
Oh, it went. Did it go?
It's okay, but please turn on your camera also.
Yes. I have been using photobiomodulation for a few years, and for the...
Sorry, Dr. Halil, please turn on your video also. Could you find the icon of camera in the end of your screen?
Yeah. Is it okay?
Not yet.
Yeah.
Still, we cannot see you.
Me or the presentation?
Dr. Halil, we have your PowerPoint. It's okay. Dr.
Okay.
Please.
It's okay. It's okay. Now it's okay. Please.
Okay. Manchester started with photobiomodulation, started with my aunt's Alzheimer disease diagnosis. I will try to, what can I do more, because there is no cure for Alzheimer's disease, we know that. So for enhancing her life with Alzheimer's, I got the first device, maybe some of you used that from USA, V-Light device. Then I introduced with Ms. Mariam and Science Beam team, and then I got a device, and I am using the Photino device for a few years. I'll share some of my cases about them. I think. Yeah, can you see my presentation?
Yes, we have.
Yeah, okay. This was the previous researchers talk about that for the neurobiology of photobiomodulation. So I'll skip them. We know that we have been using transcranial photobiomodulation for neuropsychiatric disorders such as neurodegenerative disorders, Alzheimer's, Parkinson diseases, or others. In my generally in my practice, I have been using for depression, for cognitive enhancement, ADHD, and autism spectrum disorders, and also in a few stroke patients in my clinical practice. We know that there are the traumatic events, also global ischemia, stroke, traumatic brain injury, dementia, and also anxiety, autism, post-traumatic stress disorder, obsessive compulsive disorder, learning disorders, addiction, etc. There are many research for the use of photobiomodulation for neurodegenerative disorders, and I have been using in my patients with Alzheimer's disease and some patients with Parkinson diseases. I generally combine the techniques because generally in Turkey you have to make the patient feel better, and in my clinical practice there is a private clinic. They have been using photobiomodulation, and I am their counselor. I have started to use photobiomodulation devices in the hospital that I'm working. It's a government hospital, but because of some issues, political issues or other issues, they didn't let me use my device. So in a private clinical practice, we have been using it. I have been using photobiomodulation not only in psychiatric disorders, also there are colleagues there, and there are neurologists, psychiatrists, and family GP medicationers there. And under my counsel, they have been using in different patients, Alzheimer's, Parkinson, some of the patients with stroke. And also in my clinic, I have been using in patients with depression, in patients with ADHD for a few years. We know that photobiomodulation for neurodegenerative diseases, especially for Alzheimer's disorder, Parkinson's disease, and also in epilepsy, traumatic brain injury, stroke, and other neurodegenerative disorders such as frontotemporal lobe dementia and Huntington diseases, etc. There have been some research about the using of photobiomodulation on these kinds of disorders. It also, for example, in Alzheimer's disease, by activating the nitric oxide system and blood vessels, and by mitochondrial system, ATP, etc., you mentioned before, it leads to decreased tau and decreased tau hyperphosphorylation. Because we know that tau is the aggregate that is in the brains of the Alzheimer's disease patients, and that leads to Alzheimer's disease symptoms. Also, it leads to photobiomodulation leads to improved memory functions in patients with dementia, and activation of signaling pathways by preventing apoptosis and enhancing cell survival and anti-inflammatory effects. Also in Parkinson's disease, it leads to prevent the decreased dopaminergic neuronal loss and increased expression of nerve growth factors such as brain-derived neurotrophic factor, GDNF, etc. And also in patients with stroke, epilepsy, we know that there is an inflammation and neurodegeneration, also apoptosis in these kinds of disorders, and because of the calcium because of the exaggerated levels of calcium and etc. And inhibited excitotoxicity, it leads to, and vasodilatation, increased blood flow, and oxygen delivery also in these disorders. It leads to clinical improvement of the symptoms. You know that TPBM safety has FDA approved in a randomized controlled study, which included about 1,000 patients with stroke. No significant difference in side effects was reported between the sham stimulation and the active TPBM. Other studies, some reported very mild side effects such as headache, insomnia, a little bit irritability, and strange taste in mouth, these kinds of side effects. And also it is safely and efficient in children and adolescents. We know that because there is a study made by Lashman and colleagues. They treated children and adolescents with autism spectrum disorder, administering low-level light therapy 8 times for 5 minutes, and no side effects were reported at the time from the skull and temporal areas. And also their results they show that there is a decreased irritability after treatment in the active TPBM group. And also there is a slide about the TPBM for protocol for autism spectrum disorders. You can see the some features of the laser and power output, power density, such as energy density. These are the physics, and I am clinician. I generally use them because generally you can, in some devices, you can set the parameters of the stimulation of this photobiomodulation. In some devices you cannot. This is a V-like device, you know that. There's a few months you can use 20 minutes in a day and for 5 days a week. There are different kinds of devices, but in my clinical practice for the last years I have been using Photino device. You know that Photino device, there are 8 laser diodes in the device and 4 channels. All channels are connected with 2 diodes. You can also set the photobiomodulation stimulation parameters, such as the duration, such as the power, the frequency, etc. And also, for example, for depression protocol, generally we do use alpha protocol, because in depression alpha waves are diminished in the brain of depressed patients. Also, photobiomodulation can it affects electroencephalographic waves, brain waves, such as alpha, theta. There is a different effect. For example, if you have less waves, for example, it increases, and if you have exaggerated too much levels, for example, if you use the same frequency, generally it diminishes, and there is a balance. It generally brings to a balance the brain waves. And also with the change of the brain waves, generally it's seen that the symptoms of the depression diminishes. Maybe Mariam can say much more about this. Also, for example, for protocol for autism spectrum disorders, we sometimes use low frequency, sometimes use very high frequency, such as gamma, or sometimes such as theta also. I have some cases in the private clinic we have been treating. I said before that we generally do not use just one technique, because in the private clinic, generally we do combine the techniques to have better results, because the paying patients want the better results. So I combine the techniques. Generally, I have better results. I do believe that, because I combine the techniques at my own also. Transcranial direct current stimulation plus photobiomodulation. There is a 66-year-old female patient diagnosed with moderate Alzheimer's dementia. She had symptoms of amnesia, behavioral symptoms such as apathy, depressive mood, could hardly meet her daily activities, also such as eating, taking shower, getting dressed, etc. Moderate dementia, implemented the mini-mental state exam that shows the severity of the dementia, implementing the moderate dementia. We started transcranial magnetic stimulation 5 days per week to frontal lobes, and also 2 days per week alpha photobiomodulation with full laser probes. After 4 weeks, her attention was better than before, and apathy and depressed mood diminished. Her mini-mental score was 14. It increased from 12 to 14. Her daughter told us they have seen a good response from the treatment and planning to have future sessions. Second case is a male patient, 45 years old, diagnosed with severe unipolar depression. he was charged to hospital because of severe depressive symptoms, loss of appetite, and bad sleep quality. He has been taking 2 antidepressant and 1 mood stabilizer agent. We planned first to perform him electroconvulsive therapy. It's known as the most powerful treatment of the depression in the world. His family did not accept that because there are some risks. For example, the patient will have a short general anesthesia, and amnesia is a major side effect of the electroconvulsive therapy. So we started TDCS, transcranial direct current stimulation, and plus photobiomodulation 2 times in a week. After 10 days, his sleep quality and appetite was better, and we showed them at some measurement strategies such as questionnaires, tests. He started to talk with other patients in the clinic. There was a moderate treatment response. We suggested continuing TDCS and photobiomodulation, but his family members wanted to have ECT therapy. They changed their mind because they saw some good response of his roommate patient, who had depression also and got electroconvulsive therapy and with a good response. We started ECT. After 8 sessions, depressive symptoms diminished, and after 4 days, he was discharged with remission. His follow-ups are continuing at the outpatient clinic. Third case is a 54-year-old female patient diagnosed with early onset Parkinson disease, which I am following with the team in private practice. She was diagnosed with Parkinson disease 4 years ago, with showing symptoms, mild tremor at her hands, mild to moderate bradykinesia, the slowness of her movements, at on medication hours also, and apathy. We started TMS plus 2 times, sometimes 3 times a week photobiomodulation because she has been coming from another CD, a nearby CD, to the private clinic. After 4 weeks of treatment, her tremor at hands diminished. She was walking faster and than before on medication hours. We continued the treatment at 10th week of treatment. Her apathy diminished. She has been speaking more and the affect was better. The gestures was good. We planned to add functional medicine products and suggested some having other techniques. And family is thinking about our suggestions. At case 4, we started 1 month ago, a patient with autism, 25-year-old. We just performed QEEG brain mapping and started QEEG guided TMS and photobiomodulation treatment also. 6 sessions of photobiomodulation and 15 sessions of TMS occurred. His father told that he's happier than before and obeying some rules more. We are hoping to get better improvements and better news from him. This was the end of my presentation. Thank you very much.
Thank you very much, Dr. Halil, for your very good presentation. Is there any question? If there are any question, you can actually turn on your microphone.
I can see Najia wants, I think, or somebody.
We can find some in the chat.
Yeah.
Hello, Dr. Halil. Hope you're doing well.
Thank you very much.
Lovely lecture and very interesting indeed. And my question is, since you mentioned treating a couple of patients with dementia, Parkinson's, and autism, My question is, do you think starting with the low-level laser therapy in patients with early onset dementia is a good choice of proactive treatment in order to avoid any future pharmacological therapies, especially in clinic setup? Because what usually happens is that in the first initial 1 to 2 years, the family members and the doctors, they fail to identify the specific symptoms of dementia and Alzheimer's. And once the patient is starting to get worse, then they realize, oh, it's not entirely a psychiatric disorder, it's a neurodegenerative disease a patient is going through. So do you think a proactive preventive approach would be a better choice in using such a therapy and promoting it on a national level to actually minimize the incidence of this disease? Because what I see is almost every other week I tend to hear from my patients that, you know, one of my elderly is having Alzheimer's. So it was not so prevalent almost 50 years ago, but now it is. So how to manage that? Can you please describe something on that? Thank you.
Yes, of course. I have my first patient with photobiomodulation was my aunt. She passed away last year. We have been using photobiomodulation for nearly 6-7 years, plus TDCS. Also, her husband was old. Also, they couldn't use it permanently. They were living in another country, in my hometown. So I tried to follow up, but I couldn't. I think they couldn't. They couldn't use it so regularly. But there are some patients, I do know that, mild cognitive disorder or mild dementia. Also, they have better results. I can say that because if you start earlier, you will get better responses. Because we know that nearly maybe 10-15 years ago, the neuropathology begins at the brain. Before the symptoms, you can see the symptoms. So I think also, yes, in mild dementia, also if you start, maybe you can very slow the progress of the dementia. And also maybe you can reverse some symptoms, and also reverse some brain pathology, I think. I thought that I generally combine the techniques to have synergistic effect, photobiomodulation and TDCS. If possible, if the patient can reach to transcranial magnetic stimulation, TMS plus photobiomodulation. And also, I got a friend that has very huge experiences on functional medicine. They give some devices. They support. İngilizce sunum yapıyorum. Eyvallah. They support the system because we support the system by food intake and also by some additives, for example, some functional medicine medications, and also if you add to photobiomodulation and if to TMS, because you do by some you support photobiomodulation, you support neurons by lasers, by light, and if you support them with food, with mitochondrial-energetic foods, also food products, it will be better. I think so. Yes.
Thank you, doctor. Another question, just a couple of minutes of your time. Does it also improve patients with insomnia, with low melatonin release, like patients in their early 70s or mid 70s? Most of the time what I see is they tend to have less sleep, and this is actually going to affect their entire systems. Less sleep means less REM sleep. less REM sleep means more metabolic disorders, more diabetes, more hypertension. So is there any use of low laser level therapy on increasing the sleep or REM sleep in patients? Have you any experience of that? Thank you.
Yeah, there are some research on that. I know that. I have used not the pure insomniac patients, generally patients having depression plus insomnia, a severe symptom of depression. Yes, we can say that their symptoms of insomnia diminishes also. Yeah.
Thank you.
Thank you very much, Dr. Halil. Thank you again for your nice presentation and coming here and sharing your experience about using the low-level laser therapy and for the treatment of the brain disorders. Thank you again.